Anytime we have a themed party, Samia, my wife, will have all these ideas, and she has awesome ideas. But then all the decor, I'm the one pinning it up, putting it on the walls. I'm the one standing on the ladder. It's just,
You're like,
but
please have less ideas. Please,
I know,
let's keep it simple
but
today.
it came together really nice. It was actually really cool, the party, because it was right in time with Stranger Things coming out and the new episodes being released, and so it was pretty fun. We had like a big Demogorgon statue, a pinata for the kids. There was another Demogorgon, all the lights with the Happy New Year sign, just like when Vecna comes, all the lights change and stuff.
Yeah,
We made clouds with little lights hidden in them. So it was a fun time. The kids had a
awesome, dude.
blast too. They had no clue it was Stranger Things, but
They had no idea what it was. They
it was
just saw
good.
lights and
Correct.
no Demogorgons, hopefully.
And it's always fun to hit a pinata.
I
So
mean, we spent our New Year's Eve in nature, man. Just outdoors, hiking, hanging out, and then I think we got so tired that I fell asleep at 10:30.
it's a good
Yeah,
bedtime.
we celebrated New Year's, turning at 9 with some s'mores and campfire, and then the kids fell asleep, and while putting kids to sleep, we both fell asleep.
That happens all
But
the
the
time,
day
man.
was fun because we were hiking. We were in Arizona, and we did a bunch of hiking and spend doors. It's it's really nice to spend just some time outdoors. I think you know after when you live in a big city and you're constantly just working and you know overwhelmed by work and I think spending time in nature somewhere quiet, peaceful, it's very nice. It's nice for wellness, right?
It is good to disengage, yeah, absolutely.
Disengage.
And wellness is the theme for the new year, right?
Wellness it is.
Yeah.
Wellness it is. Today's an interesting topic. A lot to.
Yeah.
I think it's a controversial topic. I think it's a topic that there's going to be a lot of opinions about from many different ends. A lot of different have strong opinions about this, right? So I think this is why we chose this as our first topic of the year.
Yeah, I think this whole like peptides craze, I mean the whole wellness craze, taking your health into your own hands, anti-aging, the longevity stuff, recovery, all this stuff. It's very popular right now. I mean, you go on social media, you talk to people, everyone is talking about this. My patients are so curious about it. They ask me about peptides all the time. And so, one thing, Humayun, that I think would be a good launching point for this episode, talking about, peptides, is really what is a peptide? Is a peptide just something you inject that you heard about on social media and it'll help you speed up a recovery after an injury? Like, what is a peptide really? And
Yeah.
that's like, our whole body is made of peptides, made of proteins. It's one of the most common things, the whole building block of our body, like collagen, all these proteins. All a peptide is just a string of amino acids that eventually become a protein. Peptides are the building blocks of proteins, and proteins, there's so many different kinds of proteins. And so when people think peptide, I just don't want people's knee-jerk reaction to be, oh, this is some molecule or some agent or some drug that can make me heal faster or make me sleep better or make me live longer or make my immune response stronger. Those are all potential touted effects of certain different peptides, but a peptide can even be something that's very common and everyone's heard about, like insulin, which is a
Yeah.
medicine that's been around forever. Yeah, insulin is a
Yeah.
peptide. Same thing
I,
with like random stuff that's non-medication, like snake venom. When you get bit by a snake or bit by a spider, those are peptides. Those are proteins in the venom that exert negative effects. So this whole class of molecule of drug, potentially peptides and proteins, is very broad, and it's not just something you hear about for faster recovery, longevity, and stuff like that.
I mean, I don't know if you remember in college, in medical school, through biochemistry, how many amino acids did we have to memorize, right?
Yeah.
Like there was a whole list of different amino acids that we had to memorize, go through them, and then those amino acids, different molecular structures formed of different elements, right? Bonded by certain type of bonds, form amino acids, which then are combined together to form peptides, and those peptides further link together to form proteins. And everyone knows what proteins are, but peptides is this word that kind of grew, and some people don't truly know what peptides are, but we've learned about peptides all our lives. I mean, through medical school, through college, peptides were little signaling molecules in the body that send signal from one part of the body to another, and they tell a cell what to do a lot of times, right?
Totally, yeah. I mean, it gives direct signaling to the cell. Usually, you have a receptor on the surface of the cell, and a peptide molecule comes in and it interacts with that receptor. Something occurs. Usually, the receptor changes shape. It sends another molecule now within the cell that goes to the nucleus, that headquarters of the cell, and it does something. The cell changes. The cell secretes something. The cell interacts with another cell. Whatever happens, that downstream cascade, that's really what these molecules do. That's what these peptides and protein signaling molecules do, is it's intracellular and intercellular communication to do something. And that something could be a huge variety of things. It's not just one type of action.
Yeah, so I don't want people to, there's two camps in this, right? There's people that are in the wellness industry. They're online influencers. Some very learned people, some not so learned people, some true scientists that are doing research and truly understand biochemistry, organic chemistry, science, and know what peptides are. And then there's a lot of people out there that have heard, and they're really into working out and really into focusing on their health and building their bodies into uh, you know um, these temples of strength. Uh,
Well said. Well said.
uh,
Just jacked dudes online, basically.
yeah, and that's where the whole industry kind of blew up, right? I mean, I think for me, so what I was saying is there's two camps, right? There's people that are skeptics or deniers. There's people that are embracing it fully, right? I feel like I'm somewhere in the middle where I have some skepticism, but there's also some excitement, right, about these peptides, because we do know peptides are a real thing in our body, and there's a potential benefit of this. Is an area that needs a lot of exploring, but I know the reality. There's a lot we don't know, right? There's a lot we don't
Yeah,
know,
there's
but
a ton. I mean, like patients ask me all the time. They probably come to your clinic and ask you too, but being an orthopedic surgeon, I deal with musculoskeletal injuries all the time. And patients are asking constantly because they see it online. I mean, it's in the news, it's in magazines, it's in periodicals, it's on your reels on Instagram all the time. That I use this peptide or this peptide, like BPC-157. I mean, there's so many of them, but that's a common one. Oh, you inject this, it'll heal your ankle fracture. You inject this, it'll treat your rotator cuff tear. And they ask me, I mean, people are very genuinely curious. And they want to know, is this something real? Is this something safe? Can I get it? Do you give this to me? And me personally, I don't offer it to any patient. I don't recommend it to any patient. There's a lot of doctors in Houston here where we practice that do. I know a lot of them personally. And so, me as an individual, as a physician, I can't come out and recommend something that doesn't have evidence. But that being said, it doesn't mean I'm against it, right? Like I personally, this is my personal belief. This is not a medical recommendation, but my personal belief is I think we've just scratched the surface of peptides, and there's a whole iceberg under there. Because I think this is like a type of class of medications, or I guess I should say potential medications that hasn't really existed before. Because the vast majority of them, if you look at least whatever evidence exists in cellular level studies, in culture assays, and in small animal models, not a lot of human data for most of them, but if you look at those studies, most of these are modulating effects on your body. They're not like, here's a medicine for this disease. Okay, let's go decrease blood sugar. Here's a medicine for this disease. Let's decrease blood pressure. They don't work like that. They basically modulate up and down regulate, and some medicines do both depending on the need of the body. Up and down regulate your immune response, your healing response, what type of inflammatory cell comes in and what doesn't. A lot of these things we don't know for sure what the downstream effects are going to be, what the human effects are going to be. But I just think that its ability to be more of a modulator of our body rather than just a direct, this is a disease or an ailment that's afflicting you, let's attack that specifically. It's very different than medicines that have existed before. That's
yeah,
how in my reading about it, that's how I've looked at it.
yeah, I know you're absolutely right. So as a cardiologist and someone who focuses on prevention, preventative cardiology, I get tons of questions about this. This is and every day I can't tell you how many people show up with printed out copies of Chat GPT chats about different medications and peptides and enhancing agents and vitamins and supplements. We've done a whole episode on supplements, um, And every time, anytime I'm about to prescribe a medication, the most common question is, can we do something natural, right? Can we do something that's not a medication, right? Why can't we just do diet and exercise? Why do we have to do a medication? And a lot of times my response varies, but a lot of times I like to give an analogy. Hey, you have a brand new car, you drive the car for many years, the brake pads start breaking down. Now you need repair, you need some oil change, you need brake fluids, right? Do you just let it go and try to just let the car run on its own and run its course, or you put in oil or fluid or brake fluid, or change the oil or do servicing to you know prolong the life of the car. And that's kind of how our body works, right? Our bodies need modulation, and that's kind of sometimes my philosophy on drugs are as well. But we need to have clear indications of what we're treating a lot of times, because as physicians, we have skin in the game, right? We're using our license to treat patients who are depending on us for our knowledge and our expertise, right? They're coming to us, they're depending on us to prescribe these medications, and guiding them on what will work and what will not work, what are the benefits and what are the harms. With a lot of medications, I can tell them, hey, this is why I'm doing this, this is what I'm treating, and these are the side effects and these are the potential harms of these medications, right? Now I
For sure.
prescribe.
Yeah. I mean, the lack of evidence, right? And the fact that I mean, a lot of these peptides that are touted for use by a lot of influencers, wellness proponents and stuff, a lot of them are not FDA approved. They're clearly not FDA approved. And you can only get them from so-called gray market, black market as a research chemical. And now it's being used off-label after you acquire it as an injection. Most of them are injections, an injection of some kind. That's a red flag.
But yeah, but one
Yeah,
thing
go
I
ahead.
want to kind of comment on that is when these influencers and these wellness industry people tout these molecules, right? They always add in, discuss with your physician or
Yeah,
your provider or your doctor about these before start taking them, because they don't have skin in the game. They don't have anything to lose. All they have is gain from the knowledge that they're spreading about these. And a lot of these people are very knowledgeable about these peptides, sometimes even more than us, right?
for
Because
sure. I mean,
spent a lot of research.
I'm not saying that, whoever is a proponent of peptides as a therapeutic agent, you go to some clinic, and they do a lot of peptide treatment. I mean, there's a bunch of them out there. I don't this is my opinion. I don't think they're all doing something wrong. I just think we don't, this is something that we don't know enough about for me individually to prescribe it. But there's financial incentives, obviously, right? All this stuff is cash pay. It's not through insurance. So if you're a physician that is ordering and discussing and then injecting peptides and doing your whatever treatment protocols with your patients, I for sure think there's some people that believe they're doing the right thing, and I think they're helping their patients. Anecdotally, there's a lot of evidence, right? But anecdote is not real science. There's a lot of anecdote and a lot of, oh, I did this to this patient, they got better. There's a lot of people, hear a lot of podcasts, longevity, wellness, anti-aging podcasts, and you'll hear people discuss that, oh, I have so many patients that I've injected this peptide, or this lady, she had a real bad meniscus tear. She was told she needed surgery. I gave her 3 rounds of peptide injections and she got better. Her meniscus is healed now. I mean, that's a huge claim to make, but people are going left and right making these claims. I mean, it's just, to me, I just so strongly try to practice with real evidence because I think that's the only way we know we're doing in our minds the right thing. When I hear people make claims that strongly, it just gives me pause.
But I disagree with you on that, because when there is a physician, a provider, a nurse practitioner, a PA that's using their medical license, running a clinic where patients that are trusting their knowledge and their expertise, they're coming in. These people are directly selling these peptides to them, and there's already a financial incentive there, right? There's already an issue in the first place where if if I was prescribing statin, and for every statin I prescribed I was getting $300, $200, $100, that would be a conflict of interest for the first place, am I in the right mind, right phase of mind to kind of guide them and educate them when I see that if I maybe leave out a little bit of information, maybe don't tell the complete information to them, I will have that $300 extra per this molecule, right? There's already starting off, there is a conflict of interest. Now, on top of that, as a physician, you're now touting these peptides knowing that there's no real evidence and truly don't have any real evidence of benefit. Yeah, there's theoretical benefit. There's small animal studies showing benefits, but there's no true large studies showing benefit. And also, we don't know much about the harm, and
I
that's kind
guess
of where.
we should clarify that it depends on the peptide, right? I mean, there's thousands and thousands of peptides. Some have real randomized placebo-controlled clinical trials and are used in cancer treatments, in viral treatments, sepsis treatments, right? But the ones that I think you're probably alluding to are like, these ones for so-called rapid healing after an injury or accelerate surgical recovery, right? Those ones, like the BPC-157s and stuff, they don't have real human data. You're correct.
No. No, well, don't get me wrong. I'm a very common prescriber of peptides. The peptide that I prescribe most commonly are GLP-1s, right? GLP-1s and GLP/GIP agonist medications like Ozempic, Mounjaro, Zepbound, Wegovy.
Yeah, super common.
These medications are very common now, a big part of a cardiology practice, but we have long-term data. We have 10 years of evidence on these medications. We've done trials regarding heart failure. We've done trials regarding cardiovascular outcomes. We've done trials about sleep apnea, diabetes. But in these trials, we also found out that these medications can cause harm, right? These medications potentially can exacerbate, some types of cancers like medullary thyroid cancer. These medications can cause pancreatitis. These medications can cause permanent blindness sometimes, very rare, but they can. And these medications can cause gallbladder disease. But that was found out through long-term studies in large populations when we started realizing these things. A lot of these gray market compounds that we're discussing, a lot of physicians are prescribing and selling them, but we don't know. I'm very excited about them. I mean, I'm excited for the possibility of these medications allowing me to heal patients in a sense that they don't need some of the medications I prescribe them already, right? But I need to see that data, and that's where I'm skeptical. Yeah, and maybe you're more optimistic about these. I'm more of a skeptical person right now, where I haven't seen the data, so I cannot tout them yet, and I don't think it's right to uh, um, completely without the clear discussion of the harms of it, it's right to prescribe these medications. Now, if you're having the discussion, if there's a physician that's out there that's telling them, hey, this is what we know, this is what we don't know, take it, and now this is what I think personally, and I've used these medications, and this is why I think is good. If they're educating patients on that and then giving these medications, that's completely okay and that's ethical because they're telling them the whole story.
But
But
is it completely okay? Because, like, I mean, think about it. Like you said earlier, if there is a financial incentive, right, that the physician will order it, they have it, and now they're going to upcharge it. There's always some bias, right? You have some incentive underlying it. Like, I think, it's kind of that whole idea that we're taught in medical school and training of shared decision making. That, the patient comes to you with a problem. You go through a bunch of options with them. And now it's kind of on the patient to decide. You don't really like force them or box them out or make them make a decision that you want. But I genuinely take issue in some sense, Humayun, with the whole idea of shared decision making because we, as a doctor and the patient sitting in front of me in a 10-minute, 15-minute visit, do not have a context where we can have shared decision making. The knowledge I have and the background I have and experience I have about that condition and numerous patients is far different than that patient can have. So I think what a lot of this is again, my take on it is when a lot of these clinics or providers are painting the conversation in that way that, okay, well, here's a peptide. We don't really know much about it, but it could have all these benefits. It's already a type of patient that is seeking an alternative type of treatment. You've already got a captured audience. I think it's a very easy sell to sway that patient to fork out a bunch of cash for this treatment. And that sounds like a negative vibe that I'm painting on this thing. I personally, like I said at the start, am positive that peptides do have a lot of potential. But I think the way that you go about doing it, administering it to patients, I think that's really, really where the danger zone is. Not just, liability wise for yourself. In terms of ethics, you genuinely don't know what the treatments are. Like, you don't know what the effect is going to be other than anecdote.
Yeah. And there are a lot of my friends, I know personally people that sell some of these compounds that they truly believe in them and they truly believe in the benefits of them. And the discussion that we have is, yeah, there's a greed on the other side as well. There's a whole pharmaceutical industry that only picks and choose certain molecules and compounds that they know they can sell and make money off, right? Something that does not have much viability in terms of future production, establishing a brand and being able to sell it does not have much viability in the pharmaceuticals eyes, and they're not going to work on that molecule to make it better and be able to have it accessible to masses, get it FDA approved. Because FDA approval, like we've talked about in our clinical trial episode, FDA approval is a long process. It takes a lot of investment, a lot of money, and a lot of pharmaceutical companies are not willing to make that investment initially to get these molecules improved. They're not, they got lucky with GLP-1s. GLP-1s were they were analogs, they were stable compounds that also were improving people's diabetes, right? It was improving blood glucose and sugar. So they had a way to kind of get the studies done and get FDA approval. And then eventually the other studies came on later. The weight loss trials and the cardiovascular outcomes trials came on later. But initially, the diabetes was the easy, low-hanging fruit that they were able to capture, right? So
Yeah,
with
and
GLP-1,
one thing, Humayun, you mentioned that's very specific and important is that the GLP-1s are analogs, right? They're not the exact natural compound found in that Gila monster venom and all that. These peptides, like BPC-157, I think that it's only like 15 amino acids. A lot of these are really short chain. They're not synthetic molecules. They are real things in our body today. Like BPC-157 is made in the stomach. It's part of gastric secretions that we all have. And so you can't patent that because that exists in every human's body. So the fact that you can't patent it, it really makes it difficult to monetize. And the fact that it's such short chain, tiny, tiny, tiny little fragments of amino acids, only 15 amino acids, 20 amino acids, 30 amino acids, they're not, like you said, they're not stable. It's very difficult to keep them stable in a fridge, on a shelf, or anything like that. And then how do you administer them? A lot of them, these small, tiny little peptides, are not going to be stable when they pass through your digestive system. You can't take them orally. You got to inject them, which is, again, a lot different than the other drugs like you were mentioning. A lot of those GLP-1s, initially injections, there's oral compounds now too, right?
yeah.
So, I mean, there's a lot of incentive behind certain peptides versus others, just depending on the molecule itself.
Yeah, so some of these potentially really beneficial peptides like BP7 157, BPC-157 or TB500 or whatever, they may never see FDA approval or may never see those large scale trials because pharmaceutical companies do not have that incentive to monetize them, right? Because they cannot monetize them. And that's kind of where
Yeah.
that dilemma is, right? Hey, as a physician, I want every single compound out there that can help my patients and uh, help with them with their healings, joint healing, wellness, longevity. But how will we get that evidence to really know if that molecule causes benefit or harm? There
And
will
that
not be
that
clinical
that
trials.
dilemma is on the patient side too, right? Because I mean, people in general, I think in the last decade plus, the whole like aura around anti-aging and longevity and lifespan, health span has been around for a long time, but especially in the last 10 years with the advent of social media, everyone's listening to podcasts, everyone's reading about this stuff. How can I help my life? How can I improve the length of time I live, but also the quality of life, decrease the medications I take? That's a real thing, and patients want to know that. And I think, this whole, like, all we've just been talking about the pharmaceutical industry and how a lot of it is very much financially driven. It has to be. These companies are not, charities, right? These giant companies like Amgen and stuff, they want to make money. They're a business. And if they don't have an ability to make money from a product, they probably will not go after it. Whereas a lot of these compounds, since they can't be patented, they can't be monetized, they could be left by the wayside. And I think the average person has a distrust right now of some level in medicine in general, in healthcare in general, in the pharmaceutical and insurance industries in general. And in some way, maybe rightly so. Like we were talking about this a little off air, and I think it's very relevant. Like the COVID and the time around COVID really sparked a lot of distrust because people were skeptical. Is COVID real or not? Is the vaccine needed or not? Do we need another booster or not? First, the CDC is saying this, then Dr. Fauci is saying this, but this country is doing this. Do we need lockdown? Do we need masks? How much 6 feet distance? What, like every little thing was questioned, changed, altered, added, subtracted, it constantly, right? That was a huge, I think, real hit in a negative way on the whole business, industry, science of medicine. People have this distrust. And these peptides, since they're not often coming directly from a medical establishment or a big pharmaceutical company, I think a lot of people like that. I think they like the fact that they're getting them secondhand or that they're seeking them out themselves rather than being prescribed them for some chronic disease.
Yeah, there's been such a big mindset change. There's the
Huge.
mindset of people over the past 10 years. We've seen that change has come through our medical training where the doctor's word was considered unchangeable, right? I mean, 15 years ago, 20 years ago, what your doctor said, you just followed, right? Followed blindly, many times. And then as information became available, internet just was available in the palms. Social media became such a big deal. Podcasters and influencers, anyone able to come on air, talk about their areas of interest and educate patients and people about that, right? And then COVID happened, right? COVID was handled poorly, right? I mean, and what was the option, right? When people talk about COVID was handled poorly, this was a once in a generation pandemic that came all of a sudden where people did not see it coming. Some people saw it coming, some people did not see it coming. We were just trying to figure it out at the time, and there was this perception that our establishment, our institutions know exactly what to do. But in that situation when COVID came, people just did not know what to do, and we were trying different things out, right? There was ideas, oh, does hydroxychloroquine work? Does monoclonal antibodies work? Do does
Yes, some people were even touting Lysol.
Yes, Lysol, ingesting Lysol works. Now
Yeah.
the vaccine came in, and the vaccine was the Operation Warp Speed, right? The vaccine was created very fast, and then there was this whole skepticism about vaccines and should we
Well,
take
and
them,
it
should
was,
we
you
not take
remember,
them?
it was a new class of vaccine, right? mRNA vaccines, which was never a thing really before. It was a whole new thing. So there was that distrust too, which I find kind of funny, to be honest with you, that it's like the same the same people, the same talking heads that were so skeptical of the COVID vaccine because this is new. We don't know anything about it. There's no evidence behind it. A lot of them are the same people touting peptides right now.
And they're injecting them
Yeah,
without knowing what could
right,
happen,
right.
right? Without any
Yeah.
large scale studies. They don't need studies for this, right? They don't need studies for these potentially beneficial but potentially very harmful molecules.
Yeah, yeah,
But
yeah.
they do need strong studies for the vaccines, which has a lot more data than these, right? So that's kind of where the skepticism came in. And then I think the other skepticism came in when the mandates happened, right? Where people were getting fired, losing their jobs because they wouldn't get the vaccine. And then we started telling people that, hey, even though you've already had COVID twice, you still need to get the vaccine or you lose your job. And that pissed a lot of people off because that was not right, right? I mean, I think most people can now look back and say that, hey, a lot of times we were just making general blanket statements and policies that were not very applicable to every person, and some people probably did not need those mandates, right? Because if they've already had COVID, they had certain type of immunity that maybe a vaccine was not really helping them as much, and forcing them to get the vaccine at the time was maybe not a good idea. But on the hindsight, I mean, looking back again at that time, what choice do we have? What choice do we have besides to make public health policy? Public health policy, when it's made for everyone. You don't
Yeah,
pick.
it's the utilitarian approach. It may suck for the individual, but the hope is it's best for society at large. But I mean, I just, to circle back, I think it did sow a lot of distrust and skepticism in medicine and healthcare in general. And I think that combined with just how much everyone's on social media and has access to information that, is spoken very articulately by a lot of people who are touting things like these peptides. I think that's a big combination that's led to a huge hype and interest in them. I mean, I've just seen in the last couple of years, there's so many more patients that have been asking me about peptides than I ever thought. I mean, like when I was in dude, when I was in residency and fellowship, I've never even heard about this stuff.
Yeah.
No patient talked about it. But in the last couple of years, I mean, it's exploded. I have not had a clinic in the last year, for sure, that a patient hasn't asked me about peptides.
Wow, yeah. I mean, let's kind of get into that, right? So we know the more common ones, right? We know we've talked about GLP-1s being peptides, and we know about insulin being a peptide. These are very commonly used. But what are some of the? Let's talk a little bit about the gray market ones, the ones that are being
Yeah, we
used
should.
as research chemicals, and they're not really FDA approved, and they're still being widely used by a lot of these wellness clinics. The most common one that shows up is BPC-157, the body protection compound 157.
Yeah, I mean, I think this is probably the most common one, the most popular one, because mainly it's, the people that are interested in this, I think, are the ones that are, very into fitness and health, and these people that get injuries. They want to recover faster and stuff like that. And sometimes the option is take time off, have surgery, or they found now this third leg of the stool. But basically, to break down BPC 157 a little bit, we mentioned earlier, it's naturally occurring. It's in everyone's stomach secretions, meaning it's stable in the stomach. It was actually like found by a bunch of Croatian scientists. And if you look up the data, if you actually look up the real studies that have been done on BPC 157, the vast majority of them are actually out of Croatia. And so a lot of these studies that were done on this compound that give us the initial information that we have are cellular level studies and a lot of rat studies. And so in those, let's talking about the rats, right? Because they're a mammal, so you can. What people have really done is they've extrapolated the rat data and said, okay, it will do this, right? Which is a huge leap to take, but that's what it's been. Several interesting rat studies that highlight the repair capabilities, the immune modulation capabilities, inflammation modulation capabilities. Is so one study that was done, they took a bunch of rats. They took two groups and they just cut the rat Achilles tendon. And the Achilles tendon, I mean, you can't, if you have a transection of the Achilles tendon, especially a quadruped like a rat, you can't walk. And so they had one group that they injected in their stomach, not even at the site, in their stomach, just BPC 157. And the other group, they didn't do anything. And at the end of the study, when they sacrificed these animals, obviously, so they can examine under the microscope the repair and all this stuff. At the time when they sacrificed the rats, they injected them serially with BPC-157 in the stomach. The group that had the injections, it was remarkable. They had essentially complete healing. And even when you look at the microarchitecture under the microscope, I mean, there were fibroblasts bridging all the signs you see in a healthy tendon that had healed. And the group that did not get any injection, nothing. They didn't heal. Because that tendon transection, when you transect the Achilles, it doesn't just cut and stay there. It's not like a piece of cloth. It retracts. Every time it's like an accordion. It's under a lot of tension. That's how it exerts force. You can't exert force unless there's tension in the body, right? So that's a very commonly cited study, and it's a very common thing that I've had patients actually ask me in clinics specifically who have like a rotator cuff tear in the shoulder, which is another tendon injury. Hey, can I just inject BPC 157 instead of you fixing my rotator cuff? And it's like, you look in the MRI, their rotator cuff is ripped off, their humerus and retracted. I mean, it's like, it's not going to just find its way there because you shot up a bunch of goo in your shoulder. But like,
Who knows, right?
we don't know, right? I mean, I'm making that claim. I'm making that claim very confidently, but I guess the right answer is I don't know because
You
that
don't
study
know.
just hasn't been done. And that's the real reason science is needed. Human data is needed because we don't know, because we're not rats. But so
Yeah, I mean,
that's something that's extrapolated a lot.
that's why there's the nickname for BPC-157, right? It's called the Wolverine shot.
Wolverine shot. Yeah, that's right.
Like Wolverine shot because it Wolverine heals himself, and
Yeah.
BPC-157 through the rat studies have shown properties of healing very rapidly,
Tons,
and
man. I mean, there was a similar, almost identical study they did with the quad tendon, the quad muscle, which is your thigh muscle, which again, you cannot walk, you can't move around, especially a rat, if you transect the quad. And the same thing happened. And in that, it was through the muscle level, not the tendon. And they had real myocytes, muscle cells growing. They had all the markers of muscle cell proliferation, like Desmond and all that stuff, when they looked at it under the microscope. I mean, it was there, which in the other group it was not. Those are real things.
Yeah.
In terms of regulation, we mentioned it's not FDA approved. So you can only get it on the gray or black market, whatever color market you will. You can't get it. It's not legit in that sense. It comes as a research chemical, and then you use it off label. It's also banned by like the World Anti-Doping Agency. So for athletes competing, professional athletes, if it's found that you're taking it, I mean, it is a banned molecule, just like anabolic steroids.
Yeah,
Even though it
there's
is
also
not a steroid, it's a peptide. It is a banned molecule.
there are some studies that have also shown some benefit in gastrointestinal disorders, right?
For sure.
In,
Yeah.
in people with peptic ulcer disease or
Hmm.
inflammatory bowel syndrome, and
Yeah.
IBS. I mean, there is gut healing properties of this
For
compound as
sure. And
well.
that's like what the postulate is that it's a natural gut secretion because it has some gut protective properties. It even improves sphincter tone, which helps decrease acid coming into the esophagus, decreases ulcers in rats. It's been shown to do that. It very strongly modulates blood vessel growth, which I think is one of the main proposed reasons why it has such a beneficial effect to healing, because you can't heal anything if you don't get nutrition and your immune cells to the site. The immune system is not just to fight bacteria, it heals stuff. But you can't get that stuff there if you don't have the route. And the route is the blood vessels. And
So
it really stimulates angiogenesis,
yeah, so
which
with that
which could
angiogenesis, I
go.
mean, the promotion of angiogenesis is interesting because that's how it's the benefit is provided, right? By creating blood vessels to a certain part of the body. But you know what else needs blood vessels to grow? Tumors.
Yeah, it could
Uh,
promote tumor growth.
so the fact that it can possibly build blood vessels and feed tumors and help them grow much faster is a potentially very dangerous part of this compound, right? That a lot of the wellness influencers do not talk about sometimes. Some do. Like, yeah, I listened to Huberman's podcast about this, and Huberman did mention that as well on the podcast. But tumor growth acceleration is a big concern with this, and until like we talked about it with GLP-1s, I mean, we saw some certain type of cancers being promoted or exacerbated by usage of GLP-1s. I mean, we don't know if unregulated consumption of BPC-157 can lead to accelerated tumor growth and even create new tumors in the body because of the angiogenesis aspect,
For
right?
sure. And that's a huge point too. The unregulated consumption. What you just mentioned, Humayun, because one of the biggest facets of clinical trials is to figure out really like what the right dosing is, not just in terms of concentration per dose. What route of dosage do you use that's safe and effective? How much to give per dose? How often to give it? How many do you need to cycle it on and off? I mean, is it just a thing you take every week, every day? You don't understand that stuff and know that stuff till you do real trials and find out. And that stuff just hasn't been done. There's been only one human study to my knowledge, and it was done last year in 2025 on BPC 157A, BPC 157, and it only had two patients.
Yeah.
And that entire study was one male and one female. And on day one of the study, they injected them with 10 milligrams. On day two, they gave them 20 milligrams. And they found no negative effects. That was the whole study. This is like not really much to it.
Yeah.
That's it. There's been no other human data.
When we do phase two clinical trials, in phase two clinical trials, we have like six different arms, and each different arm has different dose and different length of the way the medication is going to be given, right? We don't know how many milliliters, what's the frequency of BP, do we inject it every day? Do we inject it once a week? Do we inject it once a month? Yeah, we have the half-life of the molecule, which is very short, right? So that means do we inject it every day? And
Yeah, you
does
just don't
injecting
know until you study it.
does injecting every day for a month cause you to develop a tumor within a month? Does it or does it not? I don't know. And that's why we do
Yeah.
studies. But like we talked about, the frustrating part is the studies may never get done,
Right.
right?
Right.
So
One like really random effect of BPC 157 that I was reading about, which like it just shows that these molecules, just like the GLP ones, have so many disparate effects in our body, right? They're signaling molecules. Yeah, BPC 157, again, this is in rats. It shows that if you expose a rat that is on BPC 157 to acute alcohol intoxication, like a load of alcohol to the rat, that would make them like beyond drunk. I mean, massive acute alcohol intoxication. The BPC 157 exposed rats compared to non-exposed rats had a much lower effect of getting intoxicated. All of the signs in rats, like the human correlate in a rat of being dizzy, slurring your speech, acting goofy, inhibition of stuff, all of those were diminished. And the BPC-157 seemed to mitigate the effects of acute alcohol intoxication. And similarly, in rats that were now chronic alcoholics, because cessation of alcohol, just like in humans, creates withdrawal, which can kill you. Alcohol withdrawal can be lethal. BPC-157 in the alcohol withdrawal rats, once the alcohol was withheld, did not pass away, did not experience mortality like the other rats did. So, like, and I bring this up just because it's so different than the other touted effects of BPC-157. It means there are some real central nervous system acting effects of this peptide, at least in the rat population. There's no other way it can modulate
Yeah.
acute alcohol intoxication and withdrawal because those act on the receptors in your brain. I mean, so it just goes to show we're just scratching the surface. We have no idea what the potential good or bad effects could be of these
I
of
mean,
these
that's how
not even
peptide
medicines,
signaling
drugs.
works, right? That's how peptides, because a peptide can go in and bind to one receptor and have a completely different effect, and go and bind to a different receptor and have a completely different effect, right? It can have activating effects on some receptors and antagonizing or inhibiting effects on some receptors.
Correct.
So, and that peptide can be slightly changed in their structure, and that effect can be completely different, right? A lot of times. So it's very interesting. And just like GLP-1s, a lot of these peptides do tend to work on many different body parts and
For
have many
sure.
different benefits. And I'm excited about finding more about it over the years. I think this is, like you said, it's a horizon that still needs to be conquered. you know.
Yeah,
So
I
other
mean, it is exciting though. Despite like me very openly saying I don't prescribe it to my patients just because I don't have the data, I am very excited about it because I think once the real science comes in, just the fact that it is something new and different and has this modulation ability that it doesn't just do one thing. I think we have the potential for something that could be a game changer, but I
Yeah,
don't know.
yeah, for sure. No, so another interesting one, that I kind of came across was sermorelin, and I think we
Hmm.
can kind of hit some of these compounds a little bit and kind of talk about their benefits. But there is a lot of use of sermorelin or a similar compound, tesmorelin. And some of these actually have human studies, and some of they are there is FDA approval for certain compounds. Sermorelin was approved for a long time, and then FDA took its approval back, and it was used in a lot of like muscular dystrophy or HIV related muscle loss as well in the past. But then they started seeing issues like exacerbation of melanoma, or darkening of existing moles that worsened over time. So they took the FDA approval back because they started seeing certain harms. But these molecules are still being used quite often. Some of the times people who take sermorelin, they get that rush, that flushing high all of a sudden when they take it, and they feel very good with that. But it's also shown to have effects on increased blood pressures. But people tout about the muscle recovery and the muscle growth from sermorelin as well. And there was at some point evidence and FDA approval in the past as well.
Yeah, I mean, it's like there's so many things that are touted for muscle growth. And I think, in that sense, looking at that muscle growth, hypertrophy, all that stuff, a lot of people can get confused, who are not well versed in this stuff when they just hear it from someone who's like this jacked dude on a podcast or a social media person that, oh, I take this. This is like the secret to how I got so muscular and fit. Right, because
Yeah,
they think, oh, it's a peptide, it's a
yeah,
protein. Muscles need protein. It must make sense, right? And I don't like knock on the average person for thinking that way. It's not a flawed thought process, but it just shows that like just because it's a peptide, just because it's a protein, doesn't mean it's going to contribute in a positive way to muscle. It can have all these other effects, and that sermorelin, like you mentioned, was touted as that, but it has a lot of those other negative effects. I mean, if something is is shown to be directly related to causing tumors, melanomas, and things like that, it's clearly got other downstream signaling problems.
yeah. And that's kind of comes back to the unregulated administration of these drugs, where someone who is administering these drugs is not as well versed in some of the side effects and maybe doesn't even know the dosing that is safe to do for that patient, right?
Yeah, you know what? Here's one thing that's interesting. There's one other, and like people that are listening, there's like thousands of peptides. We're not going to talk about nearly even all of them, but just a few interesting ones. One that kind of goes along the same vein, Humayun, of possible tumor related stuff is epithalin. Epithalin is one that is like a molecule that comes from a protein complex made in the pineal gland, which is a gland in your brain. Everyone has one. And the most common thing that people know about from the pineal gland is that it makes melatonin, which helps regulate our circadian rhythm, helps us sleep. So this peptide in particular, epithalin, has two main effects that are really touted. Number one is it stimulates endogenous melatonin production. So instead of just taking melatonin pills or whatever to go to sleep, which actually decreases your body's own melatonin production over time, and in the long term can be damaging, and you need higher and higher doses of melatonin. Epithalin, again, this is animal studies. This is not like human trials, but epithalin has been shown to increase the pineal gland's own endogenous melatonin production, which again, that's a different thing that has existed before. It's again has potential, but we don't know if it's going to do that in humans and safely and what other effects it has.
Yeah.
So then the other thing, not just circadian rhythm regulation, but the other thing that epithalin is touted to do is anti-aging and longevity. And the way that it does that in cellular studies, in rat studies, is it increases telomerase. Telomerase is an enzyme in your body that extends the length of an area on a chromosome called the telomere. Basically, if you think the chromosome is just like it's like almost like an X type shape. So it has these arms. At the end of those little chromosome arms are these like caps, like protective caps that protect the chromosome DNA. And so over time, the telomeres shorten because the chromosomes divide again and again and again to keep us alive. That's cell division. That's how all of us stay alive. And over time, as the telomeres shorten with each division, that's almost like a built-in check rein, a built-in biologic clock that you ain't dividing anymore, and now that cell dies. That happens across our body. That's cell senescence. Basically, that cell, it was its time. It's a built-in clock because if you keep dividing again and again and again, just the probability of millions of cell divisions having to do every cell division perfectly and not have an error in the DNA code to become a tumor, to become unregulated growth. That's why this checkpoint of the telomeres exists. And so this peptide, epithalin, it increases telomerase activity, which actually preserves and increases the length of the telomere, meaning this cell that was designed by our body, biology, whatever you believe, to only divide so many times, now its checkpoint is extended. It doesn't have that same limit anymore. It can continue dividing, continue dividing. And at what point does that continued division over time, a long enough time scale, the probability that you're going to get unchecked, unregulated growth becoming a tumor, it's almost a certainty with a
Yeah.
long enough time scale. So that is just like you were saying with sermorelin, a lot of these effects that are so-called anti-aging because it extends telomere length. It keeps the chromosomes replicating or cells replicating longer. I mean, they were designed not to do that for a specific reason. So it's very much balancing, okay, do you want to keep long telomere length, keep your cells dividing for longer? Because that is one of the definite theories on aging. But you're balancing that against possible increased tumorigenic activity.
Yeah.
It's a huge
Yeah,
scale to balance.
telomere length has been studied for so long, and
Yeah,
so many longevity experts have worked on telomere length and figuring out how to slow down the shortening of telomeres. Right? There's been many studies looking at like use of sauna and infrared saunas
yeah.
on telomere length as well. And if there's a drug that's possibly keeping the telomere length increase, that's a major breakthrough, right? Because telomere length keeps cells young, keeps cells healthy. Now, but like you said, the issue that comes in is it's a built-in checkpoint against cancer, right? Unregulated growth, and that's where I think the theme of these peptides keep coming. We just don't know. We just don't know what happens with long-term unregulated administration and doses of these medications, right?
Like
It's
we need
funny.
data. That's what we need. We need to find out, and we can't find out without real science, without real studies.
You know, it reminds me. Have you seen that movie called Substance? That came out
No,
in
I haven't.
2024. Substance, man, this is
No,
the most trippy movie. It won a lot of awards,
really?
but it's a trippy movie about this woman that's an aging actress, right? And she she finds this magical compound that She injects and turns herself into a younger version of herself, right?
Okay.
But the younger version, and there's a whole idea that this younger version, older version has to go back and forth between the body, and the transition's painful, and they have to keep doing the transition, 1 week on, 1 week off, 1 week off, old, 1 week on, old,
Okay.
or
Okay.
the young. And then it kind of shows that conflict between those two versions about getting younger and staying younger versus getting older. And a lot of these compounds and these peptides kind of remind me of that movie. And at the end of the movie, you have to watch it. I don't want to spoil it for you, but you have to watch
Okay.
that movie to
You
really
know,
see
check it
what.
out.
Yeah, check it out. It's you're gonna be disturbed at the end of it. The movie, you're gonna feel like what did I just watch? But it kind of just whole conversation about peptides reminds me of that movie. And in the end, there are no free lunches. There's no free lunches. You cannot just go out there and inject something and just get skinny without any consequences. You cannot just go out there and inject yourself with something and just live forever. There will be a price to pay, right? I mean, there will be some price to pay possibly, uh, and death and taxes are inevitably, right?
Yeah.
They're gonna
Death,
happen.
taxes, and the unknowns of peptides are inevitable.
Inevitable. So they are going to happen. But you kind of want to talk about a little bit about some of the other peptides, or kind of touch on those. I know we talked about thymosin alpha as well. That's an
Yeah,
interesting one.
that's a good one. Because we've kind of been truthfully little naysayers regarding the peptides that they don't have a lot of data, don't have a lot of data. Thymosin alpha 1 is actually one of the few of these. I guess, I mean, like insulin and GLPs have a ton of data, but like one of these newer and more popular peptides, it does have a lot of data. It actually does have real randomized placebo-controlled clinical trials. Thymosin alpha 1, again, is a peptide. It's made in the thymus gland, which is kind of here between your lungs, right on top of your heart and your chest. It's one of the immune glands in your body. And it has very, very interesting, basically like pro-inflammatory, but selectively inflammatory effects. So the immune system has a very delicate balance, right? Of pro-inflammatory versus anti-inflammatory. And that balance is what makes us sick or healthy. It's what allows us to fight infection versus not. It what allows our immune system to kill cancer cells versus they grow unchecked. And so thymosin alpha 1 seems to upregulate the necessary pro-immune molecules. It upregulates, it particularly, we'll nerd out a little bit, but like the antigen presenting cells, it stimulates and upregulates T cell and natural killer cell response, which are critical in some of the more recent biologic therapies against tumors, against cancers, T cell and natural killer cell mediated biologic therapy. So it upregulates the exact immune elements that you need to keep your body healthy and safe and free from cancer, while downregulating just a generic inflammatory response, which I think is a very interesting effect of this, because a lot of other stuff, just like interferons, for example, which are used in a lot of like chronic viral infections, they just upregulate the shit out of your immune system across the
Yeah,
board, right?
yeah,
That's why people feel so sick. They get
yeah,
fevers, they get chills, they feel horrible, they get lethargy. It's like having like the flu on steroids.
yeah.
But thymosin alpha 1 does not seem to do that. And there is real data, real clinical trials on patients with hepatitis B, hepatitis C, HIV, patients in critical sepsis that all have decreased viral loads. They all have increased life. They have decreased mortality. Like real patients in the hospital, sick and dying with sepsis, have had mortality changes, and they've had increases in life expectancy and coming out of the hospital because of thymosin alpha 1. It's been studied head to head against interferons and shown better viral suppression, viral response in patients with HIV, hepatitis B, hepatitis C. So it, to say that all peptides don't have data, we were kind of almost like alluding to that, and I guess it's good that we brought this one up because that isn't true. Some of them, like thymosin alpha 1, actually have really good data,
Yeah.
and there are ongoing clinical trials on it. But
Yeah, they're
it's
also studying its effect on inducing chemotherapy when they're starting the chemotherapy, and
yeah,
they're
yeah,
going to
yeah.
injecting thymosin alpha, giving people thymosin alpha to upregulate the immune response, because chemotherapy overall makes your immune response suppressed. So thymosin alpha, to kind of avoid the negative effects of chemotherapy, to kind of induce thymosin alpha before doing chemotherapy, is also a practice, or is undergoing some clinical trials as well.
Yeah, I mean, I think it sounds like a awesome awesome peptide, honestly. And the fact that some of them do have really robust data is very reassuring because the ones that are used commonly in medicine, like insulin, like the GLPs, like thymosin alpha 1, I mean, they have some very sound, real benefits to a huge segment of the population that needs them.
Yeah. And the last one that I found kind of interesting is have you heard of melanotan? Melanotan is pretty much a tan and a tanning one, where people are using it to injecting it to kind of get that tan color, and for
That
improving
would be your
perspective.
favorite one, Humayun.
Yeah, I need more tanning, as you can
Right,
tell.
right.
Yeah.
Yeah,
So,
we both got a built-in SPF 15, the brown
yeah,
skin.
yeah. No, it's an interesting space, man. And I have said a lot of things about peptides just because I am a physician that's seeing real life patients and have keep coming back to having that skin in the game where I'm treating patients. They come back to me with real life side effects, or and I need to guide them and counsel them. Right? I need to have that data. When I don't have that data, I don't feel comfortable giving these patients these medications. When I just say, "Hey, I don't know," I just don't know. And I think as physicians, that's okay to say. And a lot of times, I just say, "We just don't know yet," right? And maybe in the future we will find out, and at that time I'll be very comfortable prescribing these medications. But and just like initially with GLP-1s, I had to educate myself, learn about them, learn how to administer them, right? Learn how to uh, titrate the doses, how to adjust the doses based on the patient. And as I got comfortable with it, I knew more about the side effects, more about the benefits. I'm using it very often. And as these peptides become more mainstream, become more common and usable with maybe real life data, I'll be much more excited by using them. For now, I'm going to be a skeptic.
No, I think that's very fair. It's like that phrase or saying regarding new technology that you never want to be the first adopter of a new technology, but you also don't want to be the very last adopter after everyone else has shown that it is something relevant. So, I mean, I think it's very telling and important to really appraise the validity of something before you jump on it and start prescribing it to other people that are trusting you. But once data starts coming out, once there is consistency and reliability of real science, which hasn't happened yet, but if that starts happening, I think that itself could be a game changer. But that truthfully waits to be seen.
Medicine is truly beautiful, man. Truly exciting. The stuff that we can do uh, with our bodies, to our bodies, and to heal patients. And I'm very excited about the advent of AI. I think with large data sets and large data sets that we have, and applying it quickly and finding specific treatments, and maybe getting these peptides that possibly may not undergo clinical trials because of pharmaceutical industry constraints, we might be able to find some good real life benefits using large language models, large data models, right? So let's see where things go. I'm excited.
Totally, man. Exciting time. All right, everybody. Thanks for tuning in to Two Docs, One Mic. We'll see you next time.